Hello, we're going to talk in this video about revisional bariatric surgery. Revisional bariatric surgery refers to those operations that we perform in patients that already had a bariatric operation and didn't have good results with the weight loss or had a significant weight regain in the long term. We also do revisional surgery in patients with bariatric surgery that has given the patient uncomfortable symptoms like severe reflux or other symptoms. For revisional surgery to be performed, you should look for a bariatric surgery team that does high volume of surgery, and especially those groups that are specialized in revisional surgery. At Clinica de la Obesidad, we very often perform revisional surgery, and we have several types of revisional surgery depending on what the patient had before. One of the most common revisional surgery here is the conversion of a lap band to another bariatric procedure. A lap band or a laparoscopic adjustable gastric band is a procedure that is still performed in the United States, but it was abandoned in many other countries. And we here in Colombia, we don't place a gastric band more than in the last 10 years or 12 years. We have abandoned that technique because it is very common to have patients with insufficient weight loss, with weight regain, or patients that are very uncomfortable with the band, even if they had a good weight loss. So revisional surgery refers to a second operation to produce weight loss again after a failed first procedure. There are several options to review an operation that has failed. There are several options to perform revisional options. There are several kinds of operations that can be performed. The first thing that we have to know, we have to tell patients when they come here looking for a revisional surgery, is that we have to see how is his actual operation. Why is it that patients are gaining or weight, or why is it that patient didn't lose enough weight? The two scenarios that we see are patients that have a problem with the operation. I mean, the operation is not well. It had failed because there is an anatomical problem. And the other reason is weight regain in patients that had not good eating habits. Very often we have a combination of bad habits and a problem in the operation. But the first thing we have to do after talking to the patient about the eating habits is to evaluate the state of the status of the operation. How is your operation now? There are two ways to evaluate an operation. One that is very easy to perform is an X-ray study, a contrast X-ray study. It's called a barium swallow or upper digestive X-ray study, in which the patient is drinking like a white liquid, and with an X-ray will draw the shape of the stomach, the size of the stomach, and will let us know the kind of operation and how is that operation doing, to see if we can correct something. And the other test is an upper GI endoscopy. That second test we usually perform here at Clinica de la Obesidad when we see the patient that is ready and in preparation for surgery. So the first thing for revisional surgery is to see how is your operation now. The second thing is talk to the patient and see how are your eating habits. Are you eating sweets? Are you drinking a lot? If you're going to have revisional surgery, you have to change your eating habits if you want the revisional surgery to work well and produce new weight loss. So revisional surgery is a procedure that is intended to induce new weight loss after a weight regain in a patient who already had a bariatric surgery. It can usually be performed safely, and it can have very good results depending on the patient and depending on what we find in the operation that the patient has. Thank you very much.